I am Snehashish Raichowdhury. I work in the India office of Oxford Policy Management and I work on health policy and governance. The case study was looking at different developing countries and how they could learn from each other. The criteria for looking into the case studies were, firstly, the countries which made substantial progress, both in terms of health status as well as economic upliftment between 2000 and the current time. I was assigned to Bangladesh to do the case study. Bangladesh was actually one of the important countries in this entire set of developing country set, which made impressive progress both economically as well as in terms of health status between 2000 and the current time. In fact, it graduated from a low income country to a low middle income one after 2013. It also got an UN award in 2010 for reducing child mortality. One of the success stories that came out of the Bangladesh case study was the community clinics which were started in the late 90s at the sub-district level. It was shifting of erstwhile door-to-door health services rendered by the health workers of the health department to a clinic-based services which was started for the first time in the country, bringing basic health services closer to the doorsteps of the poorer people, including women who were in dire need of such services for the first time. It appeared to us during the study that this was perhaps influenced by exposure visits to different countries. The health officials who went to the different countries to look at the different models could provide inputs from whatever they learned from the other country so that it could be absorbed and implemented in their own country. One of the big challenges in this project was, of course, trying to find out people who actually saw these policies getting implemented in the late 90s. Most of the government functionaries, they had retired by the time the study was done. So that was quite a major challenge, I would believe. One of the memories that I have from this particular case study is the workshop that we started in Dhaka in Bangladesh at the beginning of the study. The workshop included representatives from the academia. It also included retired government servants and many other stakeholders, including some donor representatives who saw those changes at that point of time. So it was really great to hear, right from them as to how the things panned out in the country, what was the context at that point of time, the political economy, and it was fascinating to hear the different perspectives of the people, how their own socio-political beliefs were actually making these interpretations different. And I don't think we would have got a chance to almost relive these kinds of experiences if we had not done this particular workshop. The three words that I would choose to describe this project would be complex, demand, revealing. Complex because learning from other countries often happen in an indirect way and there is hardly any documentary evidence for it. Moreover, learning from a country by looking at those models and then translating that particular model in the context of the host country is quite another thing. Moreover, there are a number of factors which come into play, which include political economy, reform champions present in the country at that point of time, leadership at the government levels, and various other complex variables which together contribute to that particular success of implementing the learning from another country. Secondly, demand. Only if there is a homegrown need in the host country, then only learning happens and it gets implemented. So it is very difficult, if not impossible, for one country to look at best practices in some other country and try to do a mimicry of that model in their own country without contextualizing it. Revealing, because policies are often not evidence based. They are not implemented based on evidence. However, what we have learned is that countries in similar situations or which have similar backgrounds economically or human development wise, they tend to learn much more easily from the other comparable models in other countries. So that was quite a revealing part from this study. The research is exciting firstly because it is a very good time to learn about the different health systems of these countries and how they learn from each other to improve or strengthen their own health systems. There is a lot of tacit knowledge, there is a lot of insights of the people that were there which otherwise couldn't have been captured or transferred if we had not done this study. So learning from them as to what was the particular context of that country at that point of time, how the political economy fared, how the different reform agents acted, and all these different perspectives together created the big storyline for us to understand how the learning happens. So this research indeed was very interesting from that point of view.